So PTSD, why is it that we're having so much trouble with this, as well as depression? And what I'm going to try to explain to you from a functional medicine point of view is that psychiatry only lists symptoms. It's not looking at the biological reasons or the environmental reasons or the genetic reasons why all of this occurs. And so that's what functional medicine is doing. So I'm going to explain what works, what doesn't work, why, and lifelong consequences of those failed treatments. So the question asked first is, in the United States, why do we get rid of preventative medicine? Well, in 1910, there was something called the Flexner Report, and it started at Johns Hopkins, and they realized that not all of the medical schools were teaching the same thing. And in order to be accredited, you could only teach about chronic disease. They closed all the proprietary schools, chiropractors, physical therapists, naturopathic medicine, which is really what functional medicine is, and closed 75% of all medical and psychiatric hospitals. So what remained in the medical schools is the only things that got research. The rest of us really started lagging behind. And it's only in the last 20 years we're beginning to catch up. Now, at the National Center for Complementary Integrative Medicine in Washington, D.C., they define complementary and integrative medicine as complementary interventions that are non-mainstream and are used together with conventional medicine. But I am trained in both this and functional medicine. I really prefer the functional medicine. So there are three things that you look at in functional medicine. First, you look at antecedents. What is the genetic risk? What is the family history? Then you look at triggers. Most of these are environmental. So for instance, somebody's had chronic trauma or a lot of stress or infection or toxins in the environment. And then there are the perpetuators. These are the things that happen that do not allow any conventional medicine to work as well as it could, because it's sustaining inflammation. It's sustaining things that really cause problems. And that can be simply something like lifestyle, lack of sleep, or diet. But it can also be diseases like diabetes. So what you look at this, if you were looking at this person, what do you think the core diagnosis would be? Now, I can tell you a lot of people have implicit bias. And of course, a lot of people will say, oh, she just doesn't have any control. But look at what she looked like at age 8, right? So what happened, I presented with Dr. Felitti, and he's the head of the ACEs study, Adverse Childhood Events. And in his clinic, they didn't ask a lot of questions why. They just tried to help people lose weight. And literally in 52 weeks, she went from 408 pounds to 132. But what he didn't ask is what triggered this. And after she came back, and you'll see here, some man tried to approach her, an older man who made a sexual advance towards her, and she suddenly gained 37 pounds in 3 weeks. And as you can see here, here's the trajectory of how long it took her to lose the weight, and look how fast she gained it back. Why? She'd been sexually abused from age 11 to 19 by her grandfather. And so putting on weight for her is protective, right? But it also really did trigger her PTSD. What other ways do people try to adapt? Addiction and anything that's compulsion, right? But it could be food, it could be agents, it could be anything. Smoking, for instance. All of these are ways that people are trying to cope. But then that also leads to chronic disease. My father wasn't sexually abused, but he grew up in World War II and he served during World War II and he used to smoke cigarettes. Well, what killed him was really the cigarettes, because it caused kidney disease. It caused him to have to be on oxygen, and I think ended his life 10 years early. And in fact, the same process happens for people who are chronically, physically, emotionally, and sexually abused. Their lifespan is cut by an average of 10 years. But what are the coping mechanisms? They're perpetuators, right? And so they're the things that are going to stick around, so you cannot really fully treat something. So for instance, if this lady had diabetes, they could keep trying to give her insulin, but until you deal with the core problem, which was the sexual abuse, the chronic sexual abuse, then you're not going to get her to stop overeating. and the diabetes is going to be perpetuated. So adverse childhood experiences, you can see the top 10 risk factors here in the United States are smoking, physical inactivity, suicide attempts, illicit drug use, many sexual partners, severe obesity, depression, alcoholism, history of STDs, drug use, injected drug use. There are many more. This is just the top 10. This is from a chapter I wrote with my co-chair, Jean Arnold, and we were looking at inflammation and what are the things that causes depression. Well, this is why functional medicine is so important. Sedentary lifestyle can cause inflammation. Why? Because it causes dysbiosis, which I'll get to in a minute, a change in the normal microbiome in the gut. What else can do this? Antibiotics, antipsychotics do it. Antacids do this because they change the pH of the gut and all the normal bacteria die. Obesity, of course, excess alcohol, chronic history of sexual abuse, decreased sleep actually causes dysbiosis and inflammation. Artificial sweeteners are very important because the ones here are equal, sweet and low, and I'm going to forget the other one, Splenda. All of those also change the microbiome. The only thing that's kind of safe is monk fruit or maybe agape, but in fact, Splenda can actually prevent neurogenesis in the hippocampus of the brain, the only place we can reproduce what? Neurons. And that leads to Alzheimer's. Excess stress can do this. Pesticides, because right now we're having a problem. You don't have as much problem in Europe, but we do, where we're using Roundup, which has glyphosate, and putting it in all our foods, and it acts as an antibiotic and kills off all the normal bacteria and actually promotes the growth of Clostridium. And of course, our horrible high-fat, fatty foods and sugary foods that we have in processed foods. So when we do functional medicine, we're going to go back to this. And this would have been the part of preventative medicine that got lost because of the Flexner report, and hence, that's what didn't get a lot of research. So this is just to show you again that if you have a very high ACE score, in other words, the number of traumas you've had in life, the greater that score is, the greater the underlying chronic depression and more severe. All these perpetuators cause dysbiosis. So let me get through this quickly. I have to do this quickly, so I apologize, but you have normal bacteria in the gut, and you do have some pathological bacteria, but by virtue of the fact that normal bacteria occupy so much of the space, they don't grow. However, when you do any of those things in that previous slide, what happens, you kill off the normal bacteria. And now the gram-negative pathological bacteria can overtake the gut. When their membranes break down, they give off something called polysaccharides, or LPS. And you then decrease the number of short-chain fatty acids, which keep gut integrity that were produced by the normal bacteria. And what happens? Your gut breaks down. Hence the whole term you've heard about, leaky gut. Once this LPS crosses the gut barrier, it stimulates the vagal nerve. And when that happens, the vagal nerve sends a message to the brain, and three things can happen. But keep in mind, when the gut opens, the blood-brain barrier opens as well, and inflammatory cytokines can enter. So what's the first thing that the vagal nerve may do when you have dysbiosis? Well, if I get up to give a talk like I am right now, what's going to happen? I'm going to have an increase in cortisol. I'm going to have an increase in adrenaline. But then when I sit down, because my cortisol levels are so high, it's going to come back and turn off this HPA axis, which is responsible for producing the increased adrenaline and cortisol to prepare me for the talk. So it comes back and shuts it down, and I'm relaxed again. However, those inflammatory cytokines that are now entering the brain actually block the HP axis from settling down. And so you're always in fight and flight. And in fact, when you're stimulated, your response will be 10 times higher than most. The second thing that happened, this is something I wanted to mention. That would mean you would have a high cortisol level, right? That's in the acute phase. But if chronic abuse has gone on for too long, then what happens is you actually get a decrease in cortisol. And when cortisol goes down, inflammation goes up. And you'll see that a lot of the inflammatory cytokines that you see here, TNF alpha or IL-6 go up. And then what happens is you get more inflammation, you get insulin resistance, And that, again, is going to perpetuate other diseases, other chronic diseases. The second thing that happens is you're going to block what's called the indolamine 2,3 deoxygenase pathway and the GTP-CH1. Real simple, I'm going to do it quickly. Normally, the IDO allows tryptophan to become serotonin. Normally, the GTP-CH allows phenylalanine to become tyrosine and then dopamine. But these inflammatory cytokines block that response or those pathways. And instead, you get these particular items, which are really, really excitatory neurotransmitters. And one of the things that could fatally happen here is that you could actually produce quinolytic acid, which is very, very neurotoxic. On this side, you produce neopterin. But the whole bottom line here is you're reducing serotonin and dopamine, and hence more likely to become depressed. The third thing is something called sickness behavior. And this is when microglia get activated by these inflammatory cytokines. If you remember, microglia are white blood cells in the brain. They normally go around and they're going to clean up the debris in the brain. But when you have these processes going on, which starts with dysbiosis, they get activated and they change the course of their mission. So basically, they start producing more inflammatory cytokines and they start attacking neurons. What does this look like? It looks like lethargy, anhedonia, somnolence, weight loss, decreased concentration, anxiety. So someone could walk in my office and look like they have depression, and it has nothing to do with those symptoms you find in DSM. It has something to do more with dysbiosis and the effect on the brain. So I look for these things first. This is what the microglia will do. They'll start producing inflammatory cytokines. They'll start actually eating up neurons. They'll cause synaptic stripping, and then they will actually start consuming the synapses. We're going to get neuroplasticity. What else is something else that I need to mention here in terms of depression? Well, this has to do with one of the antecedents, your genetics. But it also has something to do with, if you have a leaky gut, you can't absorb B12. You can't absorb B9. You can't absorb B6. And those are very, very essential to the folate and methylation cycle. So this is what you normally have. You have inactive vitamin B9. It combines with B6 and forms the active form of vitamin B9, which is L-methylfolate. That then combines with B12. And also homocysteine here in the methylation cycle comes up here to produce SAMe, and that actually causes DNA methylation. And this is one of the things linked, by the way, to autism and normal neurotransmitters. So again, you have risk for depression if, for instance, you don't get the B12, you're not absorbing the folate. And what happens then, if you don't have enough of the active form of vitamin B9, homocysteine levels will rise. And there actually is a correlation between low B12 and increased homocysteine in children with diabetes, with depression. Depression. Now, what is the antecedent, MTHFR? MTHFR, you can have two alleles, right? You can have a T with a C or a T with a T. Now, if you have two C's, you don't have to worry about it. But if you're TC, you're only converting from inactive vitamin B9 to the active form about 65% of the time, which means you're not going to always have enough of the active form to combine with homocysteine and hence produce your SAMe. But if you have two T alleles, you're only converting 35% of the time, and you're going to have even less active form of vitamin B9. And then even greater increases in homocysteine. By the way, homocysteine is increased homocysteine is related to the negative components of psychosis or schizophrenia. It also causes decreased cognition. And in the United States, we'll have a scale that says it's 4 to 12. Well, it really needs to be 4 to 8. But nonetheless, one other thing to keep in mind here, and this is where functional medicine comes in with the rest of the body, if you have two T alleles and a very high level of homocysteine, you're also at greater risk for heart disease. So all of these things start coming together. So there was an actual study that looked at MTHR polymorphism and what it might do to enhance the environmental risk of low folate. And it was associated with gut inflammation and traumatic stress in children. And in fact, children with a history of childhood trauma, when they had two T alleles, had a much more severe form of depression. What's the last thing? Well, this has to do with inflammation causing decreased or oxidized stress causing decreased glutathione. If you remember what glutathione is, it's the second phase in the liver when you're breaking down toxic substances in the body. What goes on here is that if you have a lot of oxidized stress, let's say this side's even working well, right? But if you have a lot of oxidized stress, homocysteine is going to be sacrificed. It's going to move in this direction. And once it does, that's irreversible. Why? Homocysteine in this case is going to be used to produce glutathione. And what does glutathione do? It is going to get rid of reactive oxygen species or free radicals that are a result of oxidative stress and destroy mitochondria. So if I find someone has a low homocysteine level, or, and I suspect, and I'm finding a lot of evidence for oxidized stress, I just give them N-acetylcysteine, 1,200 milligrams twice a day. Why? That can increase glutathione, so homocysteine does not have to be stolen from the methylation cycle. All these antecedents, perpetuators, and triggers decrease the effectiveness of any treatment for any disease that you have. But for depression, antidepressants do not work for people with a history of adverse childhood events. Now, how do I know this? Well, there was several studies, and one was particularly by Nani, and you can see here, they looked at adults who had a history of chronic childhood abuse, ACEs, versus those who didn't. And the only ones that it worked in, the only time that antidepressants or traditional psychotherapy worked was when they didn't have the history of adverse childhood events. Now, why? It's really important for you to know that if you've got chronic abuse under age 7, you're having an effect on a developing brain, and it's going to cause epigenetic effects that turn on genes that are not supposed to be turned on. And hence, you get a lot of inflammation. And until you do something about that, you're not going to, your traditional meds like, Zoloft, SSRIs, are just not going to work. In fact, I haven't used an antidepressant in a kid in the last 7 years for depression. There was another study that also looked at more proof of antidepressant failure. And you can see here again, abuse, and notably abuse occurring under 7 years of age, predicted poor outcomes after 8 weeks of antidepressants across all 3 treatment arms. And they were using Celexa, Zoloft, and Effexor. Here's, you can see the difference. Here's the responders who had no abuse, and here's the responders who did have the abuse. In terms of remission, these are the ones who didn't have abuse. These are the ones who did have abuse. All right, so we also know that if you don't really do something to change the course of the effects of dysbiosis or trauma or stress, you're at much higher risk for suicide. And in fact, you can see children with ACEs who become adults, the more scores, high scores they have for ACEs or adverse childhood events, the greater the risk for suicide later. Now, for PTSD, there are no studies, absolutely none, that show that antidepressants help with PTSD in children and adolescents. We've had 3 double-blind placebo-controlled studies to show that. So throwing an antidepressant at a kid for PTSD, if you're treating the PTSD symptoms, will not work. You have to go start looking in another direction. I use a lot of propranolol, which is a beta blocker, because it stops that fight and flight response, and the person can enter psychotherapy more easily. I also look at everything else I'm telling you about. But why is it that you have epigenetic effects? Why is it that all of these chronic abuse or trauma under age 7 prevents anybody, whether you're an adult or a child, from responding to traditional therapy or medications? It's because of epigenetic effects. And what's happening here is that the DNA unwraps, and then you either have a demethylation or a deacetylation of the DNA, and genes are turned on that are not supposed to be turned on. Well, what are they? Here's a perfect example. This is FKBP5, and they found that this gene definitely was turned on when it was supposed to be turned off, and in people who had chronic abuse. Now, what does it do? What it does is it reduces the number of glucocorticoid receptors, all of those receptors on your HPA axis. So rather than just cytokines or inflammation preventing the HPA from resettling or normalizing, you don't even have enough of these receptors in order to shut it off. And so again, what happens here, negative feedback does not occur, and you have not only a risk for depression, but you have an increased risk for developing even more events that can cause PTSD. Another one is, I'm just going to say these very quickly because we don't have time, NR3C1, that has increased methylation. And again, that one is found in, it was found in the postmortem hippocampus from suicide victims with a history of childhood abuse. Again, the glucocorticoid receptor in the HPA went down. SKA2, these are people who developed depression, PTSD, and were at increased risk. It predicted increased risk for suicide in childhood abuse. And then BDNF. BDNF was hypomethylated and had an increased risk for depression. So we're going to have to find another way of doing this, guys. Now, there are some people, and there's proof that people with the FKBP5 gene being turned back on would not respond to antidepressants. Same thing for BDNF. They did not benefit from antidepressants, pharmacotherapy, and even exposure-based CBT didn't work in these people. So you're going to have to find other ways to do this. So if all this goes untreated, that upregulation of FKBP5 increases inflammation itself and causes more problems that lead to things like insulin resistance or diabetes. So if you look at ACEs and the likelihood of heart disease, which is also a result of inflammation, you can see that ACEs increases the likelihood of heart disease itself. And as I said earlier, you know, anybody who has high scores in ACEs under age 7 particularly, they are much more risk for getting a lot of chronic diseases because of their coping mechanisms or the inflammation causing insulin resistance. So this is a whole body effect which deters quality of life. So many chronic diseases of adults are determined decades earlier in childhood. Let me say that again. Many chronic diseases of adults are determined decades earlier in childhood. Not by childhood disease, but by childhood experiences. So what do we look for in terms of PTSD? The ICD-11 came up with something called complex PTSD. And when they looked at people, this is people who got PTSD with new criteria, and they used EMDRs, cognitive behavioral therapy, exposure therapy alone, when they didn't have a history of abuse, especially under age 7, they worked very well. However, the outcome was very different for people who definitely have had childhood abuse. So even if you use new criteria to try to identify more people, it doesn't mean you're going to be able to treat them with traditional therapies. You're going to have to find something that works better. So for those of greater than 18, when adaptations to treatments were made, and what I'm saying here is you can have an adult who comes in and has chronic sexual abuse, especially under age 7, and you want to use EMDR, well, you've got to do something different. You can't just have the person go and talk about the feelings they had when they were a child when the abuse occurred. You have to then have that person talk about it in terms of what the child felt. And then the therapist rescues them. And then eventually the adult rescues them. Imagery rescripting and EMDR really were effective in people who had chronic childhood trauma and endured 1 year later. Now, why is that? Both of these tend to decrease inflammation. So, you know, I think you're going to have to, if you do EMDR, you know people who do, they're going to have adaptations to it in order to use it successfully in people with chronic abuse in their childhood. Now, they even tried to change the PTSD symptoms in kids so they could identify more of them. And what they found out, this was called the PTSD AA. It's just trying to identify more children. I don't have time to show you, but still we had people going through the cracks and not being identified. So I don't like, okay, let me put this another way. DSM, I have respect for, but DSM is just symptoms. And I really would rather look for the genetics, the antecedents, the family history, the perpetuators and the triggers, which is going to tell me what's really going on and getting to the root of the problem. So you have to really think about, well, what does that look like? Well, there's something now, and you actually, I'm sorry, I wanted to show you this. In people who are, you're going to have neurobiological effects as well. And so this is someone who's had chronic abuse as a child, and you can see these are the areas that would be normally functioning for a learning disorder and memory problems, but in the hippocampus. But look what happens here with chronic abuse. It actually affects even your ability to learn and your memory. So what happened then? We have what's called developmental trauma disorder, and this is really look at developmental effects of trauma and what it does, particularly at the age at which the trauma occurred, the effect on the developing brain, the faulty misperceptions of cues, the long-term effects of inflammation epigenetics. And so you're identifying what is causing, what was the result of the trauma that maybe we may have a biological reason for that we can start targeting. This is really based on the new concept of the National Institute of Mental Health called the research domain criteria. And it's just this, it's looking at everything, environmental insults, the age it occurred, the family history, the genetics, and treatment that actually changes all of those areas. So what SIM or complementary integrative therapies might help? Well, we know in a very small study, we need to do more of this. We know that meditation actually can remethylate the FKBP5. We know that oxidative stress and PTSD symptoms in a double-blind placebo-controlled trial actually was improved with N-acetylcysteine. Polyunsaturated PUFAs, and there is now an international recommendation based on research that your omega-3s must have a 2-to-1 ratio of EPA to DHA, and it must be at least 2,000 milligrams a day. You can have some DLA in there, but it's really incredible. If you're wasting money if you're buying something that has an equal amount of EPA and DHA. And I don't have time to explain to you why, but that's extremely important. What are other things? Yoga, Tai Chi, meditation, decrease inflammatory cytokines, and decrease cortisol. Cortisol levels have been reduced with meditation. Functional MRI analysis, when given probiotics and prebiotics, the fiber, for instance, that good bacteria live on, and those probiotics specifically had lactobacillus and bifidobacterium, it dampened the brain responses to the negative emotional stimuli in the amygdala, which was influenced by what? Dysbiosis. And this was found in individuals with inflammatory bowel disease. So it's very interesting how we're getting this tied in also to other diseases that cause dysbiosis. Emotional freedom technique. This is use of acupressure. I use it all the time with my patients. And not only does it decrease inflammation, it also decreases your perception of stress. And as many of you probably know, stress goes down, pain goes down. EFT releases serotonin in the amygdala and as well as in the prefrontal cortex. And you can see here by a study by Church in 2018, it decreases the expression of inflammatory genes, and another study decreased cortisol. Photobiomodulation, I'm not going to say a whole lot about. They're starting to do work on this, but they need to do more. Functional MRI neurofeedback has been helpful in PTSD, but I do not like 2 electrodes. I feel you have to use the 19 electrode approach. And the whole reason is because under each um, area of the brain where you have an electrode, you have all the signals together, alpha, beta, but you're not separating them out with two electrodes. When you use a 19 channel or Loretta, under each one of those electrodes, you're separating out all of the brainwave patterns and you're finding the deep source location. And you can really not only change the brainwaves in that particular area, you can also, for instance, improve connectivity. So if you have a slow connection, you can actually increase that connection by using Loretta. So basically what am I saying here? You have adverse childhood experiences, disrupted neurodevelopment, then you have social, emotional, and cognitive impairment. You have the adoption of health risk behaviors, so you start coping certain ways. You start having more disease, more disability, more social problems, and an early death. So as a child psychiatrist, I love doing what I'm doing because I'm not just using symptoms. And I'm looking at antecedents, perpetuators, and triggers. And in the book that we just published from Elsevier, which is Complementary Integrative Medicine, Child and Adolescent Psychiatry, and I'm not doing this because I make money, it's academic. You make no money when you're in academics from writing books, that you can have some real good information about some of these techniques that really help for all psychiatric disorders in children. So we're a psychiatrist, or any of you, or therapists, or anybody knows how to get a good history. We're all well suited to go through a history and pick up what's going on. But we shouldn't just be using symptoms to treat it. So this is an example of a patient I actually had. I don't have time to go through it, but you can see here anything that is labeled a trigger. For instance, no breastfeeding here means that they didn't get a normal microbiome from the mother's milk. You can even have prenatal stress that can cause effects on the microbiome. So if it's a T, it's a trigger. If it's a P, it's antibiotics. This person had a lot of antibiotics due to ear infections. Then started using opioids. Another thing that I pick up, if I have constipation or a history of constipation, diarrhea in a child, I know there's been some dysbiosis. Diet is so important, and changing the way we eat processed foods. And yes, that's hard to do, but you can use motivational enhancement therapy to do this. But I spent a lot of times empowering people by really actually teaching them so they understand the outcome. You can't do it all at once, but you can start talking about it. But you can see again that antecedents here, the mother had a history she had a history of depression and substance abuse herself. But there was also, in this young lady, there was 2 T's for MTHFR. So that was perpetuator and an antecedent. Anyway, I'm sorry I went so quickly, but that's the end.
All right, thank you, Dr. Simkin. I love the presentation, really enlightening, and especially when it got toward the end with some of the references about the supportive, complementary, the other things that could, in fact, actually be a direct intervention and treatment, is something deeply related to my work. And do you happen to know in any of those that mentioned the meditation, the EFT, or the Tai Chi yoga, any of those, was music at all part of their design
Oh,
or
actually,
and
the next. Oh, Ben, I'm sorry interrupting, but you got me excited. I was formerly
yeah,
a professional ballet dancer, and the next textbook will be on interventions, and we're doing art therapy, music therapy. I'm writing a chapter on spirituality. We're talking about meditation. There was a chapter on meditation that I did in 2014, our first book, but there's so much more to add to it now.
yeah,
We're going to be talking about nutrition. We're going to talk about exercise. We're going to talk about the broad spectrum micronutrients now that are being used. So the first part, or the first book, was what are the psychiatric disorders and what are some of these techniques you can use, right? So very interesting. Let me tell you something. There are children who have autism and for psychosis.
yeah,
You may not even be able to get folate into the brain. And the reason is there is something called the folate binding receptor antibody. And if you
right,
have that, no folate gets into the brain. And that causes real problems and worsening with psychosis and may be related to the severity of autism. But there
And is that
is something you
compromised
can
by,
use.
let me ask a quick question. Is that compromised by the amount of synthetic folic acid in basically the typical, let's say, US supermarket high carb bread, sprayed with folic acid
Junk
as opposed
food.
to wheat? So isn't there a gene interaction there that doesn't allow a large
Yeah,
percent process with
yes,
folic
but
acid
I
in the
don't let anybody, I have to tell everybody until it's more expensive. But how many times are you going out to Burger King a week, right? To eat. If you don't eat foods that are organic and are not sprayed with all the pesticides and are not, synthetic and treated, then you're not going to be able to start getting rid of the dysbiosis in your gut. You're going to have to look at your diet, your stress, all of those things. But just to let you know, when I had a kid who wasn't speaking much. We found the folate receptor antibody and we gave him folinic acid, which could enter the brain and enter the folate cycle. And a month later, he was speaking. And there's a whole lecture I could do on autism that'll
Did you
show
write,
you this.
was that published?
That is published by, actually, if you want the slides, just ask Rahul and he can email me and I'll send you the slides on that.
Oh, I'd love to
But
see
the
that.
book is good. If you get the book, it's not very expensive, like under $100. But
Beautiful.
it has tables. What we did was we wanted to make sure we validate what we did. So we graded the research, and you could only have a high recommendation for strength of the recommendation if you had meta-analysis with 2 or more randomized controlled trials that could have no bias, right? And you rated it based on that. The second level was 2 or more RCTs. The third is 1 RCT. So, you can look at the level of the quality and the strength of the research to know what you should use first. And we have that all in tables.
I would
So,
be very
yeah.
interested in a book in kind of the public science discourse. In other words, science for health and wellness within the public sphere in language that people can put into practice. That would be very fascinating. So maybe we can talk about it
Well,
sometime.
there are a lot, but the problem is that um, people want to make money. I don't write anything for money, so I don't know what that's like.
Please, I want to ask you one question. How we
Uh-huh.
can reduce the belly fat?
So forgive me if I'm not answering this right, but I think you're talking about cholesterol, right? And so if your cholesterol's high, there are lots of things you can do for that. Obviously, all those things I said in that first slide where you had all these contributions, right? But you can have a high cholesterol level, and you need to do something about it. What we normally do is we start with, I'm going to forget the name of it. It's a particular type of red yeast, but you got to watch it because red yeast is not all good. It can have some toxins in it. You need to know the brand you're using that can help. But even if you have normal cholesterol, if your small LDL is high, that's the one that penetrates the arteries. And that's what causes the plaques to form. So you can't just assume that just because you have a low cholesterol that you're okay. Really, all the things I was talking about, omega-3 fatty acids, the probiotics, the prebiotics. If you are someone, this is another thing, if you're a 2D6 slow metabolizer, I'll get genetic workups on everybody to see how things are metabolized. But if you are a slow metabolizer, 2D6, you don't break down toxins. And so you're going to have a lot more inflammation. And acetylcysteine is what I use there.